As I mentioned, my name is Patrick Keenan. I'm the Policy Director of the Pennsylvania Health Access Network. Very pleased to be here with all of you today. We're presenting this webinar in partnership with Achieva and its partners in the My Teeth Matter campaign. This has generally been supported by the DentaQuest Foundation, and we're a proud participant in DentaQuest's efforts. So we want to acknowledge the great strides that they're trying to make here in Pennsylvania. For many folks, the title of today's webinar may be a bit provocative. Medicaid pays for dental. It is one of the least understood benefits in our Medicaid program. And so we really want to raise the awareness among Medicaid beneficiaries that Medicaid is an option for them. They are able to get, they should hypothetically be able to get all of their dental services covered through Medicaid. Now, that doesn't mean that they don't have to go through some hoops, and we're going to talk about what those are and talk about advocacy efforts that folks in Pennsylvania are making to improve that process and minimize the number of hoops that people need to jump through in order to get the benefits that they richly deserve. Here is our agenda for today. We want to kind of talk about what Pennsylvania's adult dental benefits are, what is a benefit limit exception, the common problems that we often see with those exceptions, how do you troubleshoot those problems if you're working with people, in your own work, and lastly, and most importantly to the advocacy efforts, what do you do to report a problem with a benefit limit exception? So, with that in mind, we're going to kind of launch our first poll just to get a sense of how familiar the audience is with Medicaid. And that poll is, how familiar are you with helping patients navigate Medicaid adult dental benefits? The options are very familiar, familiar, somewhat familiar, and not at all familiar. So please go ahead and participate in that poll. We're going to close it out in just a minute, but we do want kind of a sense of how familiar folks are with this process. So 10 more seconds to choose your answer to how familiar are you with helping patients navigate Medicaid adult dental benefits. So we're going to close the poll, and you should be able to see the results on your screen, or if you don't, they're down in the viewing panel. But only 14% of folks describe themselves as very familiar, and another 14% describe themselves as familiar with navigating dental benefits in Pennsylvania. So don't worry, our purpose of this webinar is to help raise that awareness level. If you're in those other categories, that's the vast majority of folks. So we hopefully will be increasing your knowledge today and our resource over the next couple of months and years to help you with this process. So I think the clear thing that all of us know is that, the dental is not just something that happens in your mouth. It's not just your oral health. Dental is really about your entire health package, and oral disease, leads to infection and bacteria. It can increase the likelihood of certain kinds of cancers and other joint and muscle disorders, and certainly is a large contributor to pain and the misuse or abuse of medication to control that pain. So this is a really important issue across the board for the health and wellness of people in Pennsylvania's Medicaid program. What we don't know is that Pennsylvania previously, or many of you may not be aware, but Pennsylvania had probably one of the most comprehensive dental packages up until September 30th, 2011. Basically, it covered the whole range of services that people need, including crowns, root canals, caps, dentures, the whole 9 yards of what folks need to be healthy and maintain their oral health. But shortly after the budget was passed for the 2011-2012 year, the then Department of Public Welfare, now Department of Human Services, had to issue an operations memo that stated, based on the General Assembly's desire to reduce payments to Medicaid, that they had to take certain steps to limit the benefits that individuals were receiving. These dental benefit limits were imposed, as you can see prominently, as cost containment initiatives. And it's described here as the least detrimental impact on the healthcare needs of the Medicaid population. We know that certainly that's not true, that good oral health is a key and an essential part of people being able to maintain their overall health profile. And you can see, this is directly from the text, but I think it's an important thing for us to note that these limits were imposed because of cost containment initiatives, not because of the overall health or well-being of individuals enrolled in Medicaid. And the second thing is it's stated quite clearly up here at the beginning that Medicaid dental benefits are optional. And so while we want to see the expansion of adult dental benefits in Pennsylvania's Medicaid program, this opening text here from the Ops memo reminds us that we could, at some point, if we don't make the strong case for dental in Pennsylvania's Medicaid program, lose more benefits or potentially all benefits. And so it's an important kind of moment for us to acknowledge how critical dental is and how vulnerable it also is to further attacks. So moving on, what are the benefits that are currently covered? So as you can see on the left-hand side of your screen, the benefits that are covered automatically are generally preventative and restorative and diagnostic in their nature. So we're talking about cleanings and oral exams and things related to cleanings and oral exams. There are orthodontics and dentures that are available. One set of dentures, complete or partial, are available. Surgical extractions and the placement of a device to facilitate the eruption of an impacted tooth are available, but with prior authorization. So the benefits that we really lost in 2011 going forward were any additional cleanings. So, any cleanings more than one per 180 days, any additional dentures for whatever reason, crown. And then I will say that when we transitioned to Medicaid expansion, that lifetime limit of 1 was reset. So that did help some folks that were previously in Medicaid receive dentures and they were ill-fitting or lost and they needed a new one. But that was, while we're thankful to the administration for doing that, that was a minor yet important fix. Crowns, most importantly though, for most folks, crowns and adjunctive services, crowns, root canals, periodontics for both the gum and bones, and endodontic services are all limited benefits. So it does mean, to be really clear, they are available to Medicaid enrollees, but they're limited and require a benefit limit exception. Which brings us really to our next poll. So, we kind of want to know, as we begin to talk about benefit limit exceptions, before this webinar, were you aware that dental benefit limit exceptions exist? So we haven't really talked about them yet. We're about to talk about them on the next slide. So please note your response here: yes, no, or maybe. Give folks another 10 seconds or so to select their answer. Before this webinar, were you aware that dental benefit limit exceptions exist? All right, so we're going to go ahead and close out this poll. Our official results are about 57% of you were aware that dental benefit limit exceptions exist. About 39% no, and 4% aren't so sure, which with all of the paperwork and requirements of Medicaid, I can certainly understand why you might fall into that last category. So let's talk quickly about why the benefits that we have are not enough. The first is that, in a 180-day period, while that's the standard for those with good oral health and no dental disease, many of our vulnerable populations should be seen more often by a dentist than once every 6 months. Right now in our Medicaid program, prescriptions for saliva substitutes or topical fluoride are not permitted. Periodontal problems are really closely associated with other kinds of problems. And dentures, of course, if you're someone that does have to go down the route of dentures, you need to constantly be making sure that those dentures are adjusted and fitting well as your bone structure changes with age. Lastly, and the most kind of important part to kind of stress in all of this is that, extractions have become the norm. And it's really important to note that, many folks are losing restorable teeth that could otherwise be saved because they don't have access to a root canal. So it's a really, difficult challenge. Benefit limit exceptions are available to these benefits that would grant perio, root canals, endodontic services, other kinds of things that we mentioned were limited. And there's really 4 criteria. These are federal criteria. They're not set. It's the federal criteria for medical necessity. And these criteria you'll see as we go over what a benefit limit exception is are actually listed out on the benefit limit exception form. So basically, they boil down to people, being in jeopardy of losing their life or being put in a serious position that would jeopardize their life. That would result in the rapid, serious deterioration of the health of the beneficiary, that would be a cost-effective alternative to Medicaid, or that are required to comply with federal law. You're not going to see much action on that last option because, as we mentioned earlier, dental benefits are optional. Very few, if any, circumstances would meet that criteria, and it would be for very, very small and specific populations. If we look at these definitions, by and large, the vast majority of benefit limit exceptions that are approved are filed under the second criteria. So that there are serious health, that someone has a serious chronic systematic illness or serious health condition, and that the denial of the exception would result in the rapid, serious deterioration of the health of the beneficiary. We're going to come back to this. It's a really important text for all of us to hone in on because there's some steps that folks need to take in order to make the case that someone should be granted a benefit limit exception. We're going to check in here and really quickly as we kind of start. We're going to review benefit limit exceptions, and then we'll pause for questions because I know that we're kind of covering a lot of territory. So if you have a question, go ahead and start to put it in the question box, and we'll tackle some of those after we review the basics of what a benefit limit exception is. So this is a screenshot of the fee-for-service form. Most folks in Medicaid are going to be participating in a Medicaid managed care organization, an MCO, so the form itself may look slightly different, but all of those forms need to align with Pennsylvania's fee-for-service form. So this is typical of what you should see from any of the managed care organizations here in Pennsylvania. And as you can see, the benefit limit criteria are, the 4 of them are listed right out, the ones that we just talked about. So very basic information about both the Medicaid beneficiary and the dental provider. I think it's important to note that dental providers only are the providers that are allowed to request a BLE. We kind of lost the battle earlier on in that progress towards the 2011 limits. We would really like to be able to see a recipient or beneficiary of Medicaid request a BLE, or a physical health provider that's potentially more active in someone's care. However, here in Pennsylvania, it has to be, an oral health provider. And we're going to kind of come back to this last part on the screenshot here. The request must include documentation supporting the need for the service, including but not limited to chart documentation, diagnostic study results, radiographs if applicable. And I would really say that if applicable sounds soft, but it's really a hard requirement. And of course, medical and dental history. The bottom half of the form, again, the simplicity of this form is great. Not many forms kind of look like this. The problem with that is that the BLE process is not a very simple process. So we really don't want to give folks a false sense of ease here. While there's 4 or 5 lines up there, we really need a lot more documentation in order to have a BLE be approved. So we're going to pause here for questions. We have a couple of questions coming in. Please feel free to tee them up in your questions box. And as you do that, we will take some of those questions and then go to the last of our 3 polls, which is really about, have you ever helped someone complete a dental benefit limit exception? So turning to the questions that we've got. Sorry, I'm working with the technology to try to be able to read them, and I'm not getting the best view here of the questions. So the first question is about, do federally qualified health centers have to file a BLE? Yes. They do have to file BLEs in order to be reimbursed through Medicaid. There are, again, federally qualified health centers, and there's folks on this webinar that are much better at answering questions about them, but they do have other sources of funding to be able to provide dental care. But if you want the payment to be made through Pennsylvania's Medicaid program, they do have to file a BLE unless there's another kind of arrangement that's been made with a Medicaid managed care organization. Second question kind of coming in is, what about missing teeth and related to the second criteria, so the serious deterioration of health? So I think, the straight up answer here is that missing teeth in and of itself is not a reason for a BLE to be approved. The reason for that is that, that's actually the end result of our current state of providing dental care here in Pennsylvania. So it is not in and of itself something that would qualify someone for that. Pregnant patients with gingivitis or periodontitis receive additional cleanings during their pregnancy. So there is some easing of restrictions for pregnant women to receive perio care. We can follow up with that guidance in the follow-up email to this question, but for those that are dealing with pregnant women and certain other kinds of special populations, there are some very limited exceptions, particularly in the realm of periodontitis. Next question. So folks have been instructed that they must have a BLE denied in order to bill patients for non-covered services. Is there a way to streamline the BLE denial when a dentist believes that none of the BLE criteria apply for the patient? The need to wait several weeks to prepare, file, and wait for a response leads to delays in patient treatment since we cannot bill them until we have a response. Excellent question. So yes, a large part of the advocacy work that My Teeth Matter and its related advocates will be doing is streamlining that process. Right now, it's a heavily paper-based process. There's lots of pieces that need to be brought together. So we definitely want to change that process. And the more that your experiences with how cumbersome this process can be, are captured, the better off we're able to kind of make that case that this, especially when someone doesn't meet BLE criteria and is willing to pay and has the means to be able to do that, streamlining it would certainly help across the board. So what are the requirements for Medicaid to pay for braces? CHIP managed care will only pay for braces in limited circumstances, such as if a child is experiencing trouble breathing. Is this the same for adults or children on MA? So braces, again, kind of fall into the limited category, and you would have to be able to, for adults, let's be really clear, I am not able to kind of talk about all of the details that Pennsylvania has made on children's oral health. Again, there's probably many folks on this webinar that could give some more detailed answers on children. But for adults, it is something that's limited and generally not covered unless, again, it meets one of the medical necessity criteria. And then we'll quickly jump to a couple more questions before we move on. Thank you for keeping them coming in, and if we haven't been able to get to all of them, we will attempt to do so in the follow-up. Is a full mouth debridement a post-review or prior authorization? Great question, and again, something we'll be able to address in later issues. I think one of the questions that we have here deals with missing teeth due to eating and swallowing problems. Is a really great question. It's about, when we go back to those 4 criteria, it's about how we build out the case that someone does need a benefit limit exception. Moving on, we want to quickly, I promised our last of 3 polls. I promise you that we won't torture anyone with any more polls after this process, but our last poll is, have you ever helped a patient complete a benefit limit exception? So please record your answer on the screen. Yes or no. We didn't provide maybe at this point because we felt that this was a much more black and white kind of situation. If you don't remember, if you have, then you probably haven't, because the process is complex enough that you would certainly know if you had completed a BLE. Give it about 3 more seconds to record your answer. And we're going to go ahead and close out the poll, and only 16% of you are brave souls willing to kind of undertake this process. So thank you to the small handful of you that have. I would encourage the majority of you who have not to please continue to give us your feedback. We're going to try to address some of the basic concerns and requirements of a benefit limit exception. We hope that we can change that percentage over the course of the next couple of months with any kind of follow-up support that we at FAN or My Teeth Matter can offer. But please don't hesitate to reach out. So on your screen, you can see that some of the requirements and their corresponding concerns. So providers request a BLE on behalf of a client. And, as advocates for our clients, of course, we also want clients to be able to directly request benefit limit exceptions when a provider is simply not willing to do so for themselves. But in Pennsylvania, has to be a dental provider. Documentation here is required. And I should say to some folks are trying to go to myteethmatter.org. That is actually launching with this recording. Our communications director is waiting to kind of post the recording for today's webinar up there. So that will, when you get the follow-up email, the website, probably tomorrow morning, that website will be live. Part of the supporting documents that are required, we're talking about getting x-rays, we're talking about getting a provider letter, talking about getting a bunch of different things, and a role that many of you can play if you're a case manager or a navigator is just helping kind of facilitate that document flow. And it's often, kind of paper. There's no digital process that's being done. So helping the client collect these pieces of paper, keep track of them, make extra copies, and get them, submitted in a timely fashion to the MCO for approval or denial. Managing that flow is a really critical part. X-rays are required. You'll note the difference between my slide and the form itself. says radiographs if applicable, but realistically, we've never seen a BLE approved without some kind of imaging available. And of course, that brings us to the issue of getting copies of the x-rays, getting printouts of them, and making sure that they're readable in a quality that can be easily understood by the practitioners that are able to review the BLEs at the managed care organization. A medical explanation is likely to be required. I would almost say is required, but that often means a PCP and a dentist coordinating their evaluation of someone's overall health and their oral health, and making sure that they're speaking the same kind of language. And in our federally qualified health centers, that's almost the norm, because our FQHCs and rural lookalikes have done such great jobs at trying to make that happen. But for many that are seeing an independent Medicaid dental provider and an independent PCP, that becomes much more of a challenge. And as we've mentioned multiple times, this is still a paper chase. There's no streamlined approach to submitting this. If a couple of issues around timing and concern beyond the BLE form, and again, that reference, the MA 549, is for the fee-for-service. Many of you have or most of you would have a different form for your Medicaid managed care organization, unless you have a client that's in fee-for-service. But that has to be submitted along with an ADA claim form. So 2 forms are needed, along with all of the different supporting documentation. You can, and most dental practices will not do this, but it is available if someone has something that's urgent. Retrospective requests can be submitted within 60 days of DHS rejection of the initial claim for payment. So when a practice has made or done a root canal, they could, bill Medicaid for it, have that rejected, and submit the BLE within 60 days of that rejection. You're talking about, you have 21 days in processing for prospective requests being filed before the procedure is being done, and 30 days in processing with retrospective requests. Dental providers may appeal denials of retrospective requests within 30 days. The appeal rules are a little different for prospective ones, but 30 days, that appeal is available. There is no appeal process for prospective requests. As far as we'll talk about what is available to folks on prospective requests. And then, often the waiting game is here with the working with the PCP, because that is a very important part of the BLE process. And so, last but not least, this is not, again, it depends on the Medicaid managed care organization, but a big concern that we've seen in various plans is that this BLE may not be reviewed by an oral health professional. It may simply be reviewed by their physical health staff, nurses, or related staff members, and so that can be a big problem when we're kind of talking about getting these evaluated by someone that's actually able to help in the process. So what do we need to do? We've kind of I hope that this hasn't been a really it's certainly a very real process. It's certainly a very difficult process, and certainly one that we're unhappy with. So we're going to talk about what advocates are doing to make this better. But the very real challenge in all of this is, despite kind of knowing the truth behind dental benefit limit exceptions, we need everyone participating in this webinar and everyone at your practice sites to be raising awareness that BLEs are out there. Word on the street, and from many of the folks that Van works with, is that dental benefits aren't available beyond the cleaning. Real dental benefits, and that's pretty pervasive. It spreads across the board among Medicaid enrollees. So we need to be really active in talking about benefit limit exceptions. The other thing is we need to talk about the healthcare providers and dentists. A lot of dentists have been turned off by this practice of submitting a BLE. They don't want to do it. They know that, we hear time and time again that people say that it's going to be denied. And I think the reality is we haven't done a good job tracking the denial of BLEs. So have they been denied? Yes. The reality is we need to start very intentionally tracking the denial of BLEs and showing why they're being denied and how that negatively impacts overall health of Medicaid enrollees, and is really becoming, a cost issue for folks. So we really want, to kind of fight back and say, look, yes, they may have been denied in the past, but there's new opportunities emerging. Would you please join us in this advocacy? And that's really kind of encouraging them, both patients and providers, to be active in trying to encourage folks to submit BLEs. You yourself have signed up to be on a dental benefit limit exception webinar. So you are the front line, you are the vanguard, and the more that you can kind of, even if you are not a provider or really closely connected, if you have the wherewithal to kind of help manage this process, we'll point out more of the pitfalls along the way, but you can be a proactive advocate for the patients that you're serving. Feel free to get help. I'm going to talk about, the ways in which we at the Pennsylvania Health Access Network can support folks, but also there's other resources out there. And please, tomorrow when we do launch myteethmatter.org in this follow-up email, please, we'll talk about the process. We've made it pretty simple for folks to report the outcome of attempting a BLE or not being able to submit a BLE because of a provider being not willing, but please use us as a resource in all of this. What kind of change do we want? Ultimately, we're not going to stop until we see a full restoration of the adult dental package we had prior to September 30th, 2011. But in the interim steps, we really want that electronic submission. We really want dental practitioners to be focusing in on doing those reviews and not duplicating efforts by requiring physical health PCPs to collaborate with the dentist. Dental practitioners know their work and they know how to make these cases, and they shouldn't be undercut. And then lastly, we would like to see, we've seen some easing pregnant women and other folks that are able to get perio. We would like to show, some of the medical conditions that folks are faced with that are requesting BLEs, and we would like to expand that condition-specific eligibility that's made available to some vulnerable populations in Pennsylvania's Medicaid program. We've developed a checklist, and we're going to have this translated over into a one-page handout that you can use with folks. But it's never a good idea to kind of screenshot pages and give text that you can't read. So the gist of our checklist is, essentially the 5 points that you see on the screen. When we go back to the text that talks about, chronic and serious medical conditions and how the lack of having a limited service would, contribute to the rapid deterioration of health, we're really talking about a dentist engaging in this and not talking about simply dental terms. That's what dentists are trained to do, but really kind of coordinating with kind of making the connections that oral health is connected to overall physical health and kind of making that case. And for now, making that case, with the primary care doctor, which is the second point up here. We need that piece. Overwhelmingly, it is not required to have a letter. It is not, stipulated that you need a letter. We have never seen at this point a BLE approved that didn't have the accompanying letter from a physical health PCP. I also welcome you to challenge that if you see ones that have been, but that's it's generally when we see successful BLEs, the PCP involvement has been critical. We talked earlier about X-rays, but really just making sure that they're recent, clear, able to be read, and covering very specifically the problem. They want to see kind of a full series of x-rays, but we really want to be able to highlight the one that covers the appropriate angles of the tooth and the related problem. And lastly, was all the information submitted at the same time? So the entire packet, the x-rays, the letters, the form, along with the ADA claim form. That's the full BLE process, and we need all of those things to go together in the same packet and be tracked. Because again, we're looking at a 30-day window for processing of the prospective requests. So let's be aware of that. So I'm seeing a couple of questions come in, so we're going to kind of take a moment. If you haven't already done so, please feel free to enter the questions into the question window. And so I think this is a great question. Carol, thank you for asking it. Why are physicians involved? How are they qualified to understand dental concerns and how it impacts patients? It's an excellent question. This is, it's funny because we have for a very long time in our overall healthcare system separated oral health from physical health. And here you see, baked into the process itself, the requirement for physical health, the medical side of things and oral health to work together. So it's a great question. It does highlight the case. I think what needs to happen here is too often dentists speak in dental speak, and that's true with all practitioners, including all of us on this webinar. We generally talk like our trades have asked us to talk, and the physicians are really trying to, again, it is not, the approval of the BLE is not specific to the oral health of the patient. It's connected to the other chronic physical health conditions that a person has and how oral health contributes to that. So let's say we're talking about someone with, that's has high blood pressure or, related heart disease, right? We know maintaining oral health is really critical. But the MCO and the state in setting up this process, want the physical health provider to be talking about that connection and really describing how severe and chronic that physical health condition is. So it's not that we want a physical health provider to be talking about oral health. We want them to make the strong case about that serious chronic condition and that they are at risk with untreated oral health disease, and for the dentist and the dental provider to be talking, and clearly as to why this is best practice, but then linking it back to that physical health need that's being described. Talking about oral health alone will not result in the successful approval of this process. I'm glad that we've got fellow advocates on this that are saying, this is, the standard of care is being lowered for the poor. BLEs are rarely granted. This should be a broader civil rights issue. We are totally behind you, Wanda, and thank you for kind of bringing that up. This is a true advocacy kind of issue, and I think the issue that we need right now, all of us need as we wage this battle, is very clear and concrete data about the BLEs rarely being granted. You're right. It's kind of become de facto knowledge that BLEs are not granted, and we have data that shows that, but we need to really talk about the process, because until we can show, that the BLEs have been submitted and they meet all of the requirements for medical necessity and they're being wrongfully denied, we're kind of stuck in this, kind of paper pushing mentality that's really not helpful. So our goal of this campaign is to get out, to do a lot of paper pushing, to get out of the paper pushing mentality. Why do some MCOs require physician's signature and others do not? I'm the worst person to kind of ask as to, that's a great question. I really think it's, MCOs are their own level of bureaucracy. So not the best to be able to delve into that. But let's look, we'll try to answer a couple more questions and then try to wrap up with some of the advocacy that's going on and talking about what we're actually going to do with all of this data. Um, so the BLE packet, often doesn't stipulate physician involvement. That being said, even if it doesn't stipulate physician involvement, I welcome cases, successful cases of BLEs being improved without physician involvement. In talking with our partners, we've seen very rare cases of it being improved without a physician involvement, and that goes back to the requirement to connect it to good oral health. Or good physical health, I'm sorry, and the chronic physical health conditions. Looking just quickly, so there are some specific FQHC questions here. We've had a bunch of good ones come in, and so we'll circle back around with some of our partners on those to address some of the specific requirements for FQHCs filing them, and certainly PAC and other groups have been really good at helping describe that. So thank you for asking those questions, and we'll get back to folks later on. And so at this time, managed care organizations have some dental services. Does the service differ from Medicaid? So just to be clear, Medicaid, managed care companies are administering Medicaid on behalf of the Commonwealth. The Commonwealth sets the floor and the benefit package. The MCO is able to do anything that they want with dental, and we've seen some plans that have come up with that still require BLEs, but have been less stringent on making sure that all of these boxes are ticked. Some of them are almost assured to approve BLEs. So the managed care company can do whatever it wants. It's only going to be paid for that floor of preventative and restorative care. And I think the last couple of questions here, what if a dentist submits the request but fails to send the additional supporting documentation needed? How do you proceed? Really, that's where kind of the paper pusher role that all of us can play in here becomes really important, because it all has to kind of go together. Generally, if it they can, at that point, if the documents weren't submitted together, they can deny the BLE request because it failed to adequately justify one of the 4 criteria. So then you're kind of starting at the beginning again. But we will kind of talk about what to do when a BLE is denied. And so that's kind of coming up next. So what happens if a BLE is denied? Talk to the provider and ask them to explain why it was denied if you don't understand that reason, or if it seems like something that can be corrected. So if the x-rays weren't included, kind of let's try this again. They may use some medical terminology in the denial that, an average, again, the patient or beneficiary is going to be receiving the denial notice. Generally not the provider may get a copy of it, but it's generally going to go directly to the patient or beneficiary. And so, kind of talking to providers to understand that. PCP letters are one of the biggest areas, and we can see by some of the questions that are coming in, there's a lot of questions as to why there should be PCP involvement, and the firm answer is it's connected back to that medical necessity criteria, and really the second option, connected to a serious chronic physical health condition, and that's where we need that documentation. Of course, I'm going to say this again, we're going to make it really easy on myteethmatter.org when it goes live tomorrow for you to be able to report problems that you have with the BLEs. We're happy to kind of form a Slack team here under the My Teeth Matter campaign to kind of discuss some of the data we're receiving and how to kind of proactively engage different folks on these issues. But it's really important for us to kind of get that data kind of coming in, and we're asking for all of you to kind of help us here. And if a dentist request for a BLE is denied, the consumer will be sent written notification and can appeal and request a grievance through the managed care plan and or a fair hearing on the matter. So I love when we kind of use terms like grievance and fair hearing and we don't explain them. Our friends at the Pennsylvania Health Law Project have this really great chart that still leaves many of us confused, but it takes a step at advancing our knowledge here. So when a managed care organization denies a medical necessity request, a BLE is based on medical necessity. There are grievances that happen internal with the MCO. It's a kind of a chance to resolve the issue with the MCO. It's still formal and it's something that's tracked, but it's less formal than a Department of Human Services fair hearing. And there's a process for internal review. There's a first level grievance and second level grievance. At any time, if you're unsatisfied with that, you can go to the Department of Human Services for a fair hearing. There's also an external review if you think you've made the case and the MCO is just not understanding it and you don't want to go to DHS, you can get external review. But you can start with the grievance, and sometimes that's helpful because it really is the Medicaid managed care company that's making this decision and its related dental supports. I want to say here that as some people you can go directly to a DHS fair hearing. Again, that's more of a formal process, and it's really about making sure that the MCO was compliant with following all of the rules for benefit limit exceptions. It's not another opportunity to kind of make the case. It's much more about process than it is about the things that kind of went into the process and interpretation. So it's really up to folks, to decide how they want to kind of proceed. But both grievances and fair hearings are available and appealable. When you get that denial of the BLE, it's kind of looking for the best way to go. And since the Health Law Project kind of put this together, if you beyond kind of reporting the outcome of a BLE, if you do want to kind of take that next level action and need some additional support, the information for the Law Project's helpline is available in the bottom right corner of this slide. So we really are thankful to all of their legal expertise in supporting this process. What are we asking for in the reporting form? It's fairly simple. We're not going to be asking for you to do another arduous process. We know that simply because you were willing to kind of attempt a BLE, that's fantastic and laudable and should be supported. So we're simply asking for some contact information for either you, the assister, or the actual beneficiary, and they can directly report the problem if they want to be directly involved in that advocacy. We look for some demographics. We're always kind of trying to take a health equity lens. So we know that folks, generally if they're on Medicaid, have already met an income requirement. So we kind of have a general sense of that. But we look for other factors: age, gender, location, racial ID, as people are feeling as they're comfortable in disclosing that, because we want to paint a comprehensive picture of what's happening. We're going to ask for which of the 4 criteria, and you can check multiple ones, but it's really option 2 that we see as the driver of approvals. Though I would really love to be able to make a case on the cost-effective nature of approving BLEs. I really think that that's where the money's at, and would love to kind of explore that more with folks. We see very few approved when they're solely going over a more cost-effective measure. We would love to build that out as a better option, and so we're interested and open to ideas, but realistically, most of the BLEs approved have been done so under that serious deterioration of health because of another physical health condition. We have the checkbox just to make sure that you kind of submitted the PCP letter. Again, you don't have to submit. There's nothing that says very clearly that you have to submit. But we do want to be able to track, figure out if a BLE, was submitted without a PCP letter. We want to be able to make that case that it was or was not approved. And if you have success stories here, please feel free to use the My Teeth Matter reporting form to be able to do that as well. Of course, the outcome is really important to us: approval or denial, or just unknown, never heard, lost in the mail, other. And then, excuse me, on the follow-up, of course, we always want to be able to contact folks and when possible, be able to talk to the beneficiary to see if they're willing to kind of share their story. If you're submitting this on behalf of someone else, you can keep that patient anonymous. We know that HIPAA and other kinds of requirements may bar you from sharing their direct identity, but we'd like to be able to work with you in understanding that case better. And then hopefully if there's an option to get that person involved that's HIPAA compliant and compliant with your own center's requirements, we'd love to be able to do that. So let's kind of circle back in our last remaining minutes. If you do have some questions, we're going to leave, we're about 5 minutes to the end, to noon. So we'll be wrapping up momentarily, but if you do have some other questions, please feel free to type them in to the box. But I want to kind of come full circle back around to the purpose of this. Medicaid pays for dental care. We all need to walk away from this webinar understanding that Medicaid does pay for dental. If you have trouble, you can get a denture, crown, root canal, get a fixed cracked tooth. Surgery is available, and you have to go through a particular process, whether it's prior authorization or a benefit limit exception. All of you, we're happy, if you want to adapt this graphic, our information is down there at the bottom, but we're happy to take our logo off and our telephone number off, and you can pop on your logo and the number for folks to call. But if you want something as simple as this half-page flyer to be able to share with your clients, please let us know. Feel free to email me. We're happy to share it. But we do want Medicaid beneficiaries to be aware that Medicaid pays for dental care. Lastly, how to get in contact with me. So I am very excited about the advocacy efforts that we have been doing and will continue to do over the next year. My contact is available, and I hope to be a resource for all of you. I'm happy to talk with some of you individually because I know there's some very specific questions that folks have. Remember, on myteethmatter.org, you'll be able to report any kinds of issues. When we say reporting is available now, we mean once you get the follow-up email. Enhancements will include other resources on the BLEs, the ability of folks to be able to submit their stories and materials that kind of promote awareness of the BLE process and dental benefits in Medicaid. As I mentioned earlier, we've got an ultimate goal of lifting the benefit limits, and interim goals are kind of streamlining that process, adding additional exceptions, and making sure that dentists and oral healthcare providers, those that are most knowledgeable in this field, are empowered to be able to make good recommendations, sound professional recommendations based on their own experiences. I'm going to allow we can answer a couple more questions, but if you do have to hop off at the end of this webinar, when you do log off, there's a survey, a 4-question survey. It is not targeted overall at how well received this webinar is, just more targeted at how likely you are to engage in this process. We would really appreciate your answers to those 4 simple questions and any feedback that you have. We know that a significant percentage of you, have not done BLEs before or may not even been aware that BLEs were available. So we really want you to give us your feedback as to, with this information, would you now engage in the process? If there are any more questions, please feel free to enter them in the question dialog box. I draw your attention to the handouts. The slides will be sent out after this webinar along with the complete recording. If you'd like to download them now, they're available in the handouts section. Seeing no other additional questions, I'm going to thank you all for your time today. I really appreciate taking an hour out of your day and talking with us about dental. I'm excited about the potential to have additional conversations with all of you moving ahead and supporting you in your efforts to file BLEs. Please feel free to reach out, and thank you again for your time today. Don't forget the short 4-question survey about whether or not you would be willing to complete a BLE going forward. At this point, we're going to stop the recording, and again, thank you all. Wishing you the best of afternoons.